This morning we are discussing the impact of COVID on breastfeeding, and so I would like to welcome our speakers. We have Dr. Natalie Schenker from the University College London and Human Milk Foundation. Natalie is a future research leader, fellow and co-founder of the Hertz Milk Bank. Natalie is actually a former surgeon. She is a scientist. She is, as I said, the co-founder of the Human Milk Foundation, which aims to ensure that more babies are fed with human milk. She also holds a PhD in cancer epigenetics and is a holder of the prestigious UKRI Future Research Leaders Fellowship. And that through that work, she's working to expand our understanding of breast milk and the wonderful substance that it is. Natalie will be sharing her insights on breastfeeding and COVID. We are also joined by Dr. Clare Patton, who's lecturer in corporate law at Queen's University in Belfast. Clare's work focuses on the commercial determinants of health, especially for women and children. Her research sits at the intersection of health and business and human rights, and she's particularly interested in how corporations influence health outcomes, most often through marketing strategies, and how both soft and hard law can be invoked to help mitigate the harmful impacts. Clare will share her investigation into how companies marketing breast milk substitutes sought to take advantage of the pandemic, targeting vulnerable families and undermining breastfeeding. And our first speaker this morning will be Janet Calvert, who is Regional Breastfeeding Lead in the Public Health Agency. Janet has been a strong advocate for breastfeeding within the Public Health Agency for many years, and we at Breastival are indebted to Janet for her support as part of the Breastfeeding in Northern Ireland Strategy 2013 to 2023. In implementing the current Northern Ireland strategy, Janet and colleagues at Public Health Agency have achieved significant improvements over the last number of years, including all maternity units in Northern Ireland are now baby-friendly accredited. That was described by one of our speakers earlier this week as a dream scenario compared to the situation in maternity units in the south of Ireland. And there are expanding levels of baby-friendly accreditation within the community, with Sure Starts achieving gold accreditation and many more working towards those standards. Janet has also supported the expansion of the tongue-tie service across the region, funding or part funding infant feeding lead posts, and we're very fortunate to have infant feeding leads across every trust working in hospital and community settings in Northern Ireland, and workforce have been further supported through funding and training and support and implementing policies to support staff in the NHS who are breastfeeding when they are returning to work. Janet is also a champion of the code of the marketing of breast milk substitutes within the health service, and was responsible for the rollout of a very successful public information campaign, the Not Sorry Mums campaign, and that was evidence to improve public support for breastfeeding and knowledge of its importance within the general public in Northern Ireland. Janet was also responsible for implementing and extending the Breastfeeding Welcome Scheme, which has now been signed up by over 700 venues across Northern Ireland to signed up to this scheme. Venues include the Northern Ireland Executive, Stormont buildings and council venues across Northern Ireland, including all of Belfast City Council venues. And we are very happy that Belfast Lord's Mayor, Kate Nicholl, has joined us this morning to a breastfeeding mother herself. You're very welcome, Kate, and thank you for joining us. I'll call on you for a few words after we hear from Janet. But first up today, we have Janet, who will be sharing the findings of research that was commissioned by the Public Health Agency on women's experiences in Northern Ireland of breastfeeding during the pandemic. So I'll pass over to you, Janet.
Thank you very much, Jennifer, for those kind words. Good morning, everybody. Thank you for having this successful breastfeeding we've had so far. And I'm hoping that there'll be some good insights from the work certainly that we in PHA have been doing. So we have been really keen to ensure that we capture any learning lessons, I suppose, that were there from the response to the COVID pandemic, which has been such a huge challenge for so many expectant and new parents. So in the context of that, we decided, right, let's try and snatch up some funding and commission some work. So we managed to get Ipsos Mori to undertake this piece of work for us. So we wanted to really look at, ensuring that we acknowledge the restrictions to hospital access for partners, for birth partners, which has been so difficult for many months, especially during the lockdown and early phases. The fact that it was reduced home visits from midwives and health visitors into women's homes for that support they may need. There's less face-to-face contact for supporters at that time, and then the move to online one-to-one consultations, and the fact that all support groups move to online platforms. I think some are starting to try getting back, but it is challenging because As we all know, COVID rates are still high, and particularly among young people in the 20 to 29 age group, and that includes women of childbearing age. And I suppose it would be remiss if I didn't say, if you can, please encourage any of your friends and family who are pregnant or breastfeeding, who may not have had their vaccination, to look it up, read about it, find out more, and make that informed choice to go ahead and get vaccinated. As many of you know, Northern Ireland has the lowest vaccine uptake rate in the UK, and we're really, really concerned, that we are going to have more people ill with that, and especially now that it's coming out that some pregnant women seem to be affected really badly by COVID. So I would be remiss if I didn't say that. I think my colleagues in PHA would tell me off that this is a great opportunity, because you're all a very captive audience and you all have influence, and maybe are thinking about taking the vaccine yourself if you haven't already. And I'll get off that soapbox just now, so apologies for that. And now my screen's decided not to move. Bear with me a minute, guys. I'm so sorry, my screen isn't moving. 1 second. I'm going to stop share and go back in, okay? Can you hear me?
Yeah, we can hear you fine. That's grand. I wonder, Janet, do you have a headset? The sound isn't great.
Sound's not great, is it not? Okay, no bother. I'll put that on. That can be done, definitely. Now, can you hear me?
Yep, that's perfect. That's great.
Okay, now I just need to get this. It did work, guys. We did try it. So I'm going to stop my share and go back in again and see if it'll let me do it now.
No problem.
I always seem to have problems.
No, and we had it up and running, and then suddenly it decides not to work. But here we go. We're off again.
1 second. Let's see. Oh, moved there.
Perfect.
Thank you. So before I go any further with my talk, I just wanted to acknowledge that this piece of work, it was led by my colleagues in the Public Health Agency. Julie Neal is one of the Health Intelligence Managers, and she's also the chair of the Breastfeeding Strategy Implementation Steering Group, Monitors and Indicators Work Strand. So Julie very much led on this, as in partnership with Dr. Diana Gostrow-Breen, who has a really keen interest in breastfeeding and has been involved in a lot of breastfeeding work over the years. And then, of course, we were fortunate to have the expertise of our advisory group, which included La Leche League Individuals NCT, Breastfeeding in Northern Ireland Facebook page, peer supporters, Sure Start Breastival, yourselves, and then our health and social care breastfeeding specialists and breastfeeding researchers. So we were very fortunate to be able to have that influence in there. And of course, I must acknowledge the mothers who attended and took the time to participate in those very important online focus groups and share their experiences. So the aims of the programme, folks, I just can't see the top of my slide, but I don't suppose I can do anything about that. But that's okay. It's just because I've crammed so much into these slides.
We can see it fine.
And you see it, oh, that's good. So the aims of the study are really that, if you like, evaluation of services more so than an actual research study as such, was to explore the experience of mothers and supporters in relation to breastfeeding support during the COVID-19 pandemic, to ascertain the nature of support provided, to identify which platforms were used and preferred, to explore the reasons why women in Northern Ireland use breastfeeding support during the pandemic and their reasons for disengaging, to explore the barriers which might exist to joining a breastfeeding group, virtual or otherwise. And I've spoken before about this, how, certainly online poverty for women, not having access for families and women during it, certainly at the very start of the pandemic, was a big issue and a real concern. To examine mother satisfaction with breastfeeding support during the pandemic, to examine women's views of using online support, to ascertain the hierarchy of preference for support when face-to-face is not possible, and to explore the experiences of supporters involved in delivering breastfeeding support during the COVID pandemic. And I have to say that there was a huge move towards just learning on the go. What do we need to do? How can we try and get that support to women? And I know that Sure Start deserve a particular mention, because in Northern Ireland, they were very proactive in moving their support groups to online and having to just learn on the job, because if you're there at a group, it's a completely different set of skills than what is needed for communicating in a meaningful way online and keeping everybody together. So this is a breakdown of the focus groups. You'll see there that the study took place between 1st of March and the 31st of January 2021. It involved 5 focus groups with mums, a total of 29 mums, and 2 service providers, one being health and social care and one being the community voluntary sector. I keep getting a request to admit in the middle of a slides. Mothers in the study, in the focus groups, ranged between age 25 and 38, and we had first time and subsequent mothers. The baby's ages ranged from 4 weeks to 11 months, and the duration was anything from 2 days, which may have been mums expressing that had to switch to 11 months. And then, as you can see here from this table, that each of the focus groups had a mix of mothers from different trust areas. So we weren't assessing how's one trust doing against the other. We were just trying to find out what the picture looked like across a variety of trusts. So you can see that there was a mix there. And the numbers, you sort of think to yourself, focus groups, that's very small numbers, but actually that's about right. To get that meaningful feedback, you need a smaller group. And of course, as I say, they were done online. So this is the breastfeeding kind of messages, the feedback that came back from mums during that. And I love some of this, how breastfeeding makes them feel. So like a superhero, emotional, anxious, tired, proud, amazing, content and happy. And then some of the quotes from mums. I would say it makes me feel proud, but sometimes it's very mixed emotions. I'm proud of doing it. It's so challenging, but rewarding at the same time from a first-time mum who managed to sustain breastfeeding. And then it makes me feel closer to baby. It can be quite exhausting at times, but I definitely find it worth it. And then a first-time mum who had stopped breastfeeding, and this was the theme that came through, the mums who struggled, who felt they couldn't continue to breastfeed, often reported that they didn't get the support that they needed. So this mum said, in hospital, I didn't really get a lot of support. I felt very much left to my own devices. And it was only when I came home and I got a bit of help from my mum, I felt more able to breastfeed and like, I can do this. I didn't find it very helpful in hospital. And that is not necessarily the COVID picture. That can often be the case with in an ordinary situation where you hear mum saying things like this, I didn't get the support that I wanted. And mum said breastfeeding during the COVID pandemic has also been a godsend and uninterrupted, less pressure, easier, a skill to master, isolating, a struggle and lonely. And so as Sure Start Mum said, some mums really actually valued that uninterrupted time. That was a very big thing. So one Sure Start Mum said it was, that she had an uninterrupted journey so far and no one expected me to show up. And this had a massive impact on how successful the journey has been. Those early days are so busy and tiring too. And having to be all things to all people is just not possible. In order to be able to have that precious, precious time with your baby in the first few weeks, you do need the time and space, and you do need somebody else to take over everything else that needs to be done. And there's a bit of a Northern Ireland culture, I think. I don't know, maybe it is, maybe it isn't, but we're all into going around to see folk and expecting to get a cup of tea and even a flipping tray bake when you're there. Whereas this mum said, I would say it's easier this time around with my first, or a really big family. My door never stopped the first couple of weeks. I was always running off to my room to feed my baby, which makes me sad that this mum didn't feel she could feed in the room with everybody. And all this pressure to maybe hurry up and rush your feed and get back downstairs and make somebody a cup of tea and all that. And like 5 days after having her last baby, I was out at a coffee shop, whereas this time it was like jammies for 2 weeks. And I really enjoyed not having that pressure. And I think if we can have those conversations with new mums and say, you will be in your jammies for 2 weeks and you won't be able to do anything much else. And that's great. That's time that you and your baby need. And then I think in terms of goals, some mums reported that their expectations were very considerably from reality. I think I thought I'd gone in thinking I was really prepared and got a real shock with the reality of it. I would imagine that most of us who are mothers, and it's a long time ago since I gave birth, over 30 years, but I do remember thinking, I can do this. I'm a midwife. I know babies. I've got loads of nieces and nephews. This will be no bother to me. And the reality is quite different. So this mum said it was really hard. I didn't feel like it was plain sailing for day one. What I thought was going to happen and the reality of it was two separate things. This was a Sure Start mum. I thought it was going to be, I'll just need a wee bit of help in the hospital and then you go home. And this was the first time mother who stopped breastfeeding. And I think there's been a lot of talk in Breastival about good antenatal education and support. And I think that is crucial, but actually it's until you get your baby in your arms that the reality hits home. That, you know, for some people, they seem to fly through it, but most people over the years, for what it's worth, that I've met, actually find that it takes time and it takes patience to get feeding established. And if the moms who said they had flexible goals and approach said, well, I actually think I change my goal every week, it's quite useful to say, look, well, I'm going to see how I get on tomorrow. I'm going to see how I get on next week. And we'll see how it goes after that. And the next thing you know, the months and even the years have passed and you're still breastfeeding. And that seems to work, that flexibility for a lot of people. I think every baby is so different and every mummy is different. Absolutely. You really need an open-ended approach. And this was the first time mum who sustained breastfeeding. And then for others who maybe this first time mother who'd stopped breastfeeding said, in the pregnancy, I didn't put any pressure on myself. I just said, if it works, it works. If it doesn't, it doesn't. If it doesn't, I'm not going to get wound up about it. And there is some evidence to suggest that if you can give a kind of like that mums get to the point where they say, right, well, I'm going to do this, somewhere you've actually got that determination to succeed and you have a certain level of resilience and realization that it's not necessarily going to be smooth sailing, but it will be so worth it in the end. That can help mothers to sustain a decision to breastfeed. So the mums report, whenever the in-hospital support is something that even when you have everybody baby friendly and you think it's a dream, I hear, and my colleagues who are infant feeding leads here often hear about situations where mums didn't get the care that they should have and where it's disappointing. And we have been really worried about the COVID situation and, you know, how was that going to be? If staff were redeployed, there was less staff in the wards, if there was less direct contact. So you can see here on the two columns in the bottom, the COVID issues tended to be, there was less peer support, so less people on the ground in the ward to be able to help them. They were discharged more quickly. Their partner wasn't around as much as they would have liked. There was that restriction on visiting, which must have been so hard. And then mums also reported that there was less physical contact, you know, to check positioning and attachment. You need somebody sitting with you. You need somebody saying, here's the moment, just bring your baby on now, your baby's mouth is open really wide. And that practical support seemed to be less evident during the pandemic. The general issues were, you know, they're there all the time. Formulas offered in cases where there's concerns about the baby's fluids. Variable support from different midwives. So some midwives were amazing and some less so. Midwives were under pressure trying to get mums discharged, I suppose, early, prepared for home. You know, there was a lot more pressure in the ward situation. And then second times mums assumed to know everything. And that is the case. And we'll hear in some of the quotes, you know, that you were kind of left to your own devices. And it's in there from a first time mother who stopped breastfeeding, that bottom quote. In the hospital, I didn't get very much support and was pretty much left to my own devices. I don't feel I got much support in hospital. Don't get me wrong, the midwives were fantastic. I got the feeling that they were really busy. I was never on my, sorry, I can't read the top line, I'll try that. I was never on my own because the midwives and all the other support workers were brilliant. I have to say, I didn't ever feel lonely. Anytime I asked a question, they were more than helpful and they were guiding me. So breastfeeding support not proactively offered as standards. That's a bit disappointing because women should proactively be offered support without having to ask for it all the time. And the Sure Start mum reflected that there. The louder you shout, the more you get. Variable support from different midwives. So I didn't know very much, but neither did she. So if it's somebody who's maybe a student or newly qualified, then that sometimes shows, unfortunately. So it became apparent with this mum, her experience was that the midwife was a bit uncomfortable, and it would have been better if somebody with more experience had been on hand to give her the support that she needed. And that was a first-time mum who stopped breastfeeding. And then in relation to formula, we could have had the time to focus on the latch, but everything was just a blur. In hindsight, I would have done things differently. But when you're offered formula straight away, you trust the midwife. And that's really disappointing, you know, that other alternatives are not given when a mother is struggling, you know, not given support with positioning and attachment, even expressing some colostrum to be able to give to the baby. So as I was saying before, it's not always what we would hope it would be. And I'm sorry for that, but we do need to learn then from that feedback that we're getting from mums and make sure that people like the BFI project leads, the infant feeding leads, the breastfeeding specialists are passing that down the line and saying, you know, and auditing to make sure that formula is only given with fully informed maternal choice. Second timer substitute mothers, they thought I was doing it. They thought I knew what I was doing and they didn't have to tell me anything else, which really wasn't the case because they were so different. And you hear that over and over in families, that you have very experienced breastfeeding mums and then number 3 baby comes along and it's completely different and it's quite a challenge. So we need to be careful, all of us who are supporting breastfeeding mums, that we don't make an assumption that because they're an experienced breastfeeding mum that everything's fine. And then another mum who'd stopped breastfeeding, I was lucky that he latched right away, but after that you were sort of left because he had latched right away. So being able to get ideas and different positions and making it more comfortable, then you had to ask for help because, like, I suppose because you latched right away, it was like, oh, she's fine, so we'll carry on. You did have to ask for support, and that was a mum who stopped breastfeeding. So there's a variation across the pandemic with a step down of services in some areas and some fewer units. So home visits were invaluable, even more important to new mothers, and support more dedicated and sustained in the context of the pandemic. Those were the strengths, and you can see there by those quotes, women saying that they had really, really good support and were able to sustain breastfeeding. The limitations within the pandemic were, of course, that there was fewer home visits, and at times they were really stepped down, and women were asked sometimes to go to clinics to be checked, and that was really challenging. I know that Julie and Diana, who sat in some of the focus groups, said that they were astounded by the staying power and the resilience of the women who reported things like, well, I was like 5th day section and I had to go to the clinic and he had to drop me, my husband had to drop me off and I couldn't go in and my section wound was sore. And you just think, wow. And these women continued to breastfeed and kept with it, which was amazing. Julie was very, very impressed by that. And then any judgmental or critical approach will of course undermine breastfeeding, and it's so disappointing to hear that. But sometimes just even a word that is supposedly meant in kindness, but just subtly undermines, can have a huge impact. And you can see that in a first-time mum who stopped breastfeeding. This one lady just totally trashed my confidence this day. It just showed how one person could completely ruin your confidence. I thought I was doing okay, but I had had a good experience up until then. So it's really, really important that people's interpersonal skills and knowledge of breastfeeding is what it should be, and that any negative attitudes and care like that is challenged. And we need to ensure that the health service keeps on board, keeps on top of that. Tongue tie was an issue, and we've been working on expanding tongue tie services and getting funding in place, and getting specialists trained and being able to carry out tongue ties. So we are continuing, that's an ongoing journey. But during the pandemic, certainly you can see there from a mum in the Western Trust that she had a real challenge, because having to try from Fermanagh to see a tongue tie practitioner in Altnagalvin and drive that 2 hours just after you have a baby isn't acceptable. But we have addressed that, and I'm pleased to report that we now have tongue tie practitioners, one in SWA, Southwest Acute Hospital, and one in Altnagalvin. So in terms of, sorry, I can't see the top of my slide, so I'm struggling to read what's on there. But
so this is views on the virtual support and other support services.
Thank you, Jennifer. Lovely. So
we just have a couple of minutes left, if that's okay, Janet.
Okay. So we have video calls, WhatsApp, Facebook, social media, and socially distanced face-to-face groups. So in terms of what the benefits were for each one, so very convenient, we were saying that video was very convenient, video calls, facilitated connection at time, provided reassurance and community to discuss issues and challenges. There's no escape from disruption in the family room was the negative side of, and there was concerns about privacy, and it's not always available. So then we also were able to see there the feedback from women, from providers as well. So they felt that sometimes there was challenges with the setting up of IT, the privacy confidentiality issues, and then it being difficulty in visualizing positioning. So sorry, I'm behind. We did start a bit later, so I think I'm only in about 15 minutes, but I'll keep going. I'll fly through. So WhatsApp has certainly did have a place, and there was an instant response for an issue, very convenient to use. There was access to support and that companionship in time of isolation. And providers liked it too, but then the other side of that was mums would say they couldn't see the historical information, that for providers, there might have been some judgmental incorrect information for mums, and they couldn't read body language or access how easily someone was doing. I'm going to skip through some of these because we're running out of time. I think this is worth looking at here, this table, in terms of what the issues tended to be. So physical issues such as latch, tongue tie, positioning for feeding post section, mastitis, abscess, cracked nipples, exclusively pumping or combi feeding and weaning, social support isolation issues in terms of loneliness, isolation, having no visitors, not able to meet friends, and new friends from antenatal groups, and reports of postnatal depression. And then it was useful for things like reassurance, positive affirmation, and knowing that baby was getting enough milk. So what we did was put into that, what issues are encountered and how they could be used. So obviously with a Zoom meeting, you can't address physical issues. With a one-to-one call, you can't address the social isolation and support. And with Instagram, again, social isolation support. So there are definitely mediums that are more appropriate for certain situations. And I think this is quite useful because this makes a recommendation as to what stage you're at and then what media might be most useful. So face-to-face support from midwives, peer support showing positioning and attachment, and observing latch on. So that's really important, that hands-on support. And then a combination of Zoom calls, WhatsApp, and home visits in the early days. Later on in the early weeks, Zoom calls and WhatsApp definitely has a place. And then later in the journey, the face-to-face piece really is a very important too, a combination of both. So overall, mums valued the time and space that the pandemic provided. There was a desire for a blended approach to breastfeeding support. Mothers noted the need for practical face-to-face support in the early days to aid in establishing effective breastfeeding. Additionally, a need to consider the use of virtual breastfeeding support in line with the breastfeeding issue encountered. So again, what we're saying here is it's really important that we consider the stage, the issue, and pick the appropriate medium. And then we need to develop guidance or a policy on good practice for providers, and provide mums on how they can get with advice on how they can get the best out of online and virtual and face-to-face support. For me, I just wanted to say thank you. Thank you to all those supporters out there. Nothing will beat being there and seeing how a mother is and looking into her eyes and being able to come alongside her. And I think these images just show that, how important family and how important supporters are. Thank you, and sorry for going over my time.
Thank you very much, Janet. And I'm very pleased to be able to welcome Belfast Lord Mayor Kate Nicholl, who has popped in to join us this morning. Kate is herself a breastfeeding mother, and we are delighted to say that Kate has contributed a fabulous image of herself and her nursling to join our More Than Milk exhibition that's been installed in the Kennedy Centre this week as part of the Féile Festival. Kate, would you like to say a few words?
Thank you, Jennifer, and I'm delighted to be here. I actually haven't attended any of the Breastival events before, so particularly thrilled to be here this morning. I am going to see the exhibition this afternoon, actually, so I'm going to get a photo of it, which I'm quite looking forward to. I'm actually still breastfeeding, and my journey it's a terrible thing to say, but it's been helped by COVID. Counsellors don't get maternity leave. And I went back to work when my son was 4 months old. I had Kian in 2019, November. And I was very lucky, had a very straightforward birth. Feeding was a bit difficult in the beginning, but I had a lot of support. I actually went to the Knockbracken support group, which I found very useful. And I was very grateful for that. But when the first lockdown came, I'd been starting to express, and I really didn't think I was going to be able to continue breastfeeding. A lot of my meetings are in the evening. I was struggling with the expressing, and I didn't think that it was just going to be viable. Now he's almost 2 years old, and I'm still feeding him. So that quality time that I had at home, and I was listening, Janet, your presentation is fascinating, and so much of what you've covered is things that I've heard from friends as well. And you know, those the feedback, it's a godsend and uninterrupted and less pressure. That was definitely the case for me. But I also did find it very lonely, and it all being on you as mothers, you're solely responsible and having to get up all the time to feed the baby. I really resented that it was always me that had to get up, but delighted that I was able to feed him. And I think that the support it's so important. And I found the support with my friends so important, but the different resources, you know, the Northern Ireland Breastfeeding Facebook page, so useful, and just the different resources there. And I hope that as we go forward, what we've learned from COVID is that hybrid support and how we make sure people do have that accessibility in getting the support that they need. So yeah, my experience was slightly different, and I'm really interested to hear what everyone else has to say. I can't imagine starting the initial journey during COVID, but it's so wonderful that we have such fantastic healthcare supporters and organizations like this that are doing important work to normalize breastfeeding. So thrilled to be here, thrilled to be a part of it, and really hoping to, you know, promote the importance of breastfeeding and the need for support in my term of office. I have 10 months left. So if you have any events, or if there's anything that I can help with, then please get in touch, because I think it is something that we definitely do need to keep talking about more. So thank you for having me. Hand back to you, Jennifer.
Thank you so much, Kate, and congratulations on sustaining your journey for so long. My own youngest is almost 2, so I'm right there with you. And it is an adjustment to have someone so dependent on you, and you have that unique role to play. And there is an adjustment there, but it's also a great gift that you're the unique person that can give that gift to your baby. And thank you again for being such a vocal and visible supporter of breastfeeding during your term in office. I'm sure everybody on the call really appreciates your contributions. And I'm going to pass over now to Natalie Schenker, who's going to talk to us about breastfeeding and COVID from her perspective and her research. Natalie.
Brilliant. Can you hear me okay?
Yes, we can.
The slides, fantastic. It's a real pleasure to be here today, even though here is my office again. It feels like Groundhog Day for the last 18 months, because this is the only place it feels like I've been. But that's starting to change, and really it's a time to reflect on what's happened over the last 18 months and get some perspective on things that went well and things that really haven't gone so well. So I really appreciate the opportunity. It's just there's a world apart from where we were 2 years ago, when we're actually able to come and present at that wonderful day. But anyway, so I'm Natalie Schenker. I'm a Future Leaders Fellow at Imperial College, and my work really revolves around understanding the public health impacts of human milk banking, as well as the composition of human milk. And I could talk all day about that, but really wanted to just start by saying I'm also the co-founder of the Human Milk Foundation, which operates the Hearts Milk Bank, and that I have no conflicts of interest to declare, other than I do that work, and it really captivates my entire life. So just a step back before getting into COVID, what were the aims of the Human Milk Foundation? Well, we've just celebrated our 3rd birthday as a charity, and hopefully we'll be able to share the video that's really put together to show what's happened over the last year. But the principal aim of the Human Milk Foundation was to ensure that donor milk was always available for vulnerable babies cared for in hospital neonatal units, where it can act as a bridge to really the intervention that will make the best outcomes for those babies, which is having access to mother's milk. It also keeps babies safe from a range of perinatal complications, particularly affecting preterm babies, including a devastating gut condition called necrotizing enterocolitis. Heart's Milk Bank runs a very unique program, which is to make donor milk available where possible to families in the community. And we've just supported our 300th family, where women are facing breastfeeding challenges that mean breastfeeding is either impossible or taking time to establish. But critically, all of this work is completely free to the parents who approach the charity, but we're evaluating it. And the point of that evaluation is not only to work out the most cost-effective way to run a service, the most efficient way, and the prioritization for where donor milk should be made available, but to lay the evidence for policymakers to see the impact of our work on not just breastfeeding rates and perceptions of what human milk is all about, but critically maternal mental health. And that's what we're really starting to find is where our service can work alongside so many community services and hospital services. We've got an increasing global engagement, and I'll talk a little bit more about that, but none of this will work unless we can fundamentally change the education that's available. Myself, as a former doctor, I know that I had almost zero breastfeeding education during my medical training, and things have not improved very much. But with UNICEF developing a number of programs for medical students, dietetics, and so on, hopefully that will start to turn around. So human milk banking, for those of you who don't know much about the service, it operates like the blood transfusion service, where mothers with extra milk to their own baby's needs are screened and milk's made available primarily to babies in hospital. But what I didn't understand when I started to learn about this service is that back in the 1960s and 70s in the UK, it was a relatively ubiquitous service. This is a picture from Chicago in 1940s. But all hospitals delivering babies had some sort of milk bank, whether that was a trained staff with a pasteurizer and so on, or just a case of the culture of the unit being to ask the mum in the bay next door whether she'd spare some milk for the mum who was struggling, and then flash heat treat that in a pan. And then a virus came along, and it wasn't COVID, it was HIV. And in the 1980s, there was a growing awareness that HIV could be transmitted through breastfeeding. And there was some early work done by WHO scientists to show that pasteurization heat treatment rendered the virus, well, it destroyed the virus, and so that meant donor milk was safe. But at the same time, the formula industry was starting to invest in research showing that donor milk had issues around the growth of babies and so on. And that meant that in the UK by the 1990s, there were only 6 functional milk banks in the whole country. And donor milk rapidly became a very rationed resource. So we knew back in 2019, 2020, when we were starting to put together our risk register and so on, that a new infectious agent was probably going to be the most significant threat we could face. And then it happened. And this was a screenshot a few months into the pandemic. I'd been to a meeting in Birmingham in January, 23rd of January, and met up with Jim Gray, who's our microbiology lead, a very calm, measured man who we go to with all concerns that we've got about screening and milk microbiology. And we'd had an hour meeting about bits and bobs, and at the end I said, "So Jim, what do you think about this thing happening in China?" And he just stopped drinking his coffee and said, "Well, actually, I'm a bit worried." And we talked for a bit more, and then I literally bombed back to Harpenden to the milk bank and spent the next 6 weeks troubleshooting, coming up with every way to safeguard provision of the service, because if Jim said he was worried, then I knew that there was something coming down the track. So what came down the track? Well, it was an intense period of work during February to make sure that every aspect of milk donation at Hearts could be safeguarded, whether that was donor screening, getting blood tests done, if GP services closed, which they inevitably did, making sure that our logistics, we rely heavily on the blood banker network, who are volunteers, mainly over the age of 70, and what would we do if that all shut down? And so it was an incredible scramble to bring in extra supplies, to make sure that we had extra money, to make sure that because we operate outside the NHS, our team were not initially designated key workers. And back in February, we didn't know if there were going to be roadblocks to stop people going into work. And so we actually had a question asked in Parliament by our local MP to ensure that we could have a letter that would mean the team could continue to get into work. And so all of that work went on. And then critically, we started in March, when people were already starting to shield, getting requests from hospitals we normally didn't supply milk to, but their usual milk bank had closed or limited their provision because staff were shielding and not able to come in. And so we did something really simple. I set up a WhatsApp group for all the milk bank leaders in the UK. And it was a fantastic way to work together to make sure that the processes we'd put in place at Hearts could be adopted, and that supply of this critical resource to neonatal units could be safeguarded. And this came out in later in the month in infant, showing how we'd responded and really laying the foundation for any future milk bank response to a new infectious pathogen. I was getting involved in lots of work around human milk safety globally and in the UK, and was able to contribute to a rapid review by Mary Renfrew, really highlighting that separating mothers and babies was a really problematic policy, but one that at the time was being advocated by the Chinese Society, India, the CDC, and I'll come on to that a little bit more. And then just the most amazing thing happened is that Gillian Weaver, my co-founder here at the Human Milk Foundation, has worked internationally for over 20 years. And she was looking at the WhatsApp group for the UK and said, well, could we do this for all my contacts around the world? And so we did. And within 3 days of setting that WhatsApp group up, and frantically trying to talk Gillian through how to add me as an admin and all of that, we had over 100 members from 40 different countries. And it's really been that ability to share data and information and, frankly, morale boosting to overcome problems locally and internationally that's led to the success, the relative success of the milk bank response, but I'm aware that that's in the context of a great deal that's not gone so well. So July to November, I've just put consolidation because I don't really have much functioning memory of what happened then. Amy Brown, who I collaborate with a great deal, posted a reminder on Facebook of something we did last year for World Breastfeeding Week, and I have no memory of doing that. So there was a lot of stuff going on at the time, a lot of research being planned, and a lot more writing for specifically targeting information to neonatologists about the relative safety of breastfeeding, even if the mother had an active infection of SARS-CoV-2. Really, all the work was put in context by this paper that came out from the team at the WHO, who modelled the impact of maternal separation and uncertainty about feeding human milk, which really showed that the number of infant deaths in low and middle income countries directly due to COVID-19 was not insignificant, but under 3,000 globally. But by contrast, the modelling showed that when mothers were separated, the infant death rate could have exceeded 250,000 children by not being able to be breastfed during the pandemic. And that's just a devastating result that's really quite hard to put in context, because so many people have tried their best to overturn policies, but it's just felt like it hasn't been enough. And then, just as we were winding up to try and have a break over Christmas, December the 2nd, the magnificent vaccine was approved, Pfizer initially by the MHRA, but with a proviso that there was no contraindication, that there was a contraindication to pregnant and lactating people. I just want to focus on a couple of extra things that happened during that initial year. So Amy and I put out a survey which captured the experiences of over 1,200 women during the first lockdown, many of whom had had their baby during the pandemic, so suffered all of the separation from their partners, from their birth partners and so on, and then were trying to establish breastfeeding. And it really showed a mixed picture, that around 45% of women actually noted that it was a better experience than they'd anticipated, for all the reasons that Janet went through so eloquently in her work. But that a significant number, around 30%, had had an absolute disaster. And most worryingly was the inequity of experience and the fact that it was the women with fewer financial resources, unable to access internet support, unable to have any time out of their flats, those without gardens, those without education, and specifically Black and minority ethnic groups who were already suffering so much from the pandemic in different ways. And this was a hugely emotional paper to write because there were many stark experiences. What we didn't realise is about 6 weeks later, Alison Thewlis, who's a Scottish National Party MP, who's very involved in this space, presented the work as part of the maternity care debate in Parliament, which contributed, not our work, but the whole debate contributed to an overturn of the policy to reallocate health visitors 3 days later. And that was so important because the key finding from the paper is that most people stopped breastfeeding earlier because of the lack of direct support, including community midwives and so on. And as a small takeaway from that paper was also the experiences of mothers who were with babies being treated on the neonatal units, only allowed to see their babies on their own. We supported a number of women who were having just the most incredibly difficult times and couldn't have their partners alongside them in the NICU, even with desperately ill children. And I think when we all take a breath from what's happened in the last 18 months, the trauma that those women have gone through can really not be overestimated. Having access to donor milk has been a wonderful thing for many of them, but really this is not acceptable in any context and is a sticking plaster over a huge wound. I also wanted to point out that my poor research technician, who had to work from home for the majority of the lockdowns, went to town on a literature review looking at the antiviral functions of human milk. Because we sat down and thought about things and thought, well, there's antibodies, there's key antimicrobial factors that are really ancient, like lactoferrin, human milk oligosaccharides, lysozyme. But what else is there? Is there anything else? Because evolutionarily, the purpose of human milk, of lactation generally in mammals, is immune protection and the support of the developing immune system. It's not nutrition. That was a much later evolutionary aspect. So what is there? And we started to find papers, maybe one or two papers published, that then the research fizzled out, as it often does in this sector where there's funding strictures. But we were finding vitamins, an array of cytokines, oxysterols, steroid hormones that act. And then it started to get a bit silly with more and more. And there are even more than this to fit on the slide. But some of these could be treatments. Some of these could be effective treatments against other viral infections, other bacterial infections. And it is a wry smile that with all of the drive towards setting up new antiviral research institutes, that human milk has not been focused on, and it is literally scientists taking it into their own hands and self-funding research in this space that's largely driven this research. I don't think that's acceptable in the future. So a brief episode on vaccination. So this was a nightmare because the MHRA took a highly precautionary principle approach to the issue of lactating and pregnant women in terms of whether they could have the vaccine. But in the first wave, the people who were being vaccinated in December and January, they were healthcare professionals. They were my colleagues. They were friends who were trying to do the right thing by breastfeeding, but couldn't access the vaccine without three difficult options, and Public Health England and other public health sectors were really clear in their messaging in that first 6 weeks that if you are breastfeeding, you should wait till you have finished breastfeeding and then have the vaccine, even though the research was coming out thick and fast at that stage that there were antibodies in milk specifically against SARS-CoV-2. So that left healthcare professionals and other high-risk groups with three options. They had to lie about breastfeeding, which goes against probity and raises potential GMC issues. They had to stop breastfeeding, which in the midst of a pandemic and all of the other reasons to continue breastfeeding didn't sit well. Or they had to not get vaccinated, which then left them at a significant risk of infection as the second wave was starting to build throughout December and January. I was on the initial call with the MHRA about why they'd done it, and everybody knew that this was a difficult choice. And eventually, through the work of a number of people, including scientists, doctors, many people in the public, and groups like Pregnant Then Screwed and the Women's Equality Party, the day before Christmas, I got a call to say that this was going to be overturned. It was quite funny. I was out with my kids and messaged back half an hour later when I picked up the email saying, is this publicly available information? And she already had the out of office reply, and literally stood in the park going, what do I do? And just thought, so I texted a few of the groups that I was part of, because we had to get that information out there, because women were going day by day, choosing not to get vaccinated when the advice was coming down the track. So anyway, if they lock me up for that, who knows? But this is not acceptable. It's also not acceptable because there was absolutely no interest from manufacturers to do trials, which we could have set up very easily to do this in the context of a study, to take milk and blood samples from women who were very happily volunteering. And I was contacted by over 500 individual women who would have taken part in that trial over the course of January. And that still hasn't happened, but other groups elsewhere have managed to do it. It's just an invisible part of physiology, and it shouldn't be, but this is the job of work that we've all still got to do. So what is the evidence? Well, the evidence from vaccination generally, for all the vaccinations that have been available in the last 70, 80, beyond that years, have shown that vaccination during lactation is overwhelmingly safe. There's one particular class of vaccinations, which are live vaccines, of which there are 2 case reports ever of a yellow fever vaccine causing a problem in the baby. That's two babies in the whole world. But yellow fever vaccinations should be considered, and smallpox as well for the theoretical risk. But every other class of vaccine is overwhelmingly safe, although there isn't much evidence out there. So far for COVID, and this might be a little bit out of date, one paper shows no vaccine transfer in milk. There's a preprint suggesting that a tiny, tiny amount, and we're talking nanograms of mRNA, may get across in milk. But the authors conclude, well, it would be rapidly digested by the infant, and actually it might actually be helpful for that infant. But already human milk is chopping up coronavirus in the breast tissue and putting it into milk as a kind of antigen challenge, which acts like a vaccine anyway. And 3, and I think many more now, have shown antibody responses, which are different between different classes of vaccine, but are transferable in milk. And some of those papers for the Pfizer and AstraZeneca vaccines are showing 100% rates of antibody transfer in milk, which I think women ought to know to be able to make informed decisions about vaccination. The national registries and surveillance data, the yellow card system in the UK and the US and Canada surveillance system, has shown no evidence of significant ill effects in mother and child, but there is a bit of a spike of things such as mastitis and blocked ducts and generally feeling unwell for the mother after vaccination, which could be because they are feeling unwell and actually not feeding as often as they would do, or pumping and dumping, or doing what we think they're doing, which is stopping breastfeeding for a period of time that individual women come up with to make them feel safe about giving the vaccine, and therefore running into trouble with that. And if we had a conversation with the public about this, then we'd be able to either enable them to come up with sensible plans or make different decisions. We've talked about this at length with the Global Alliance Group of milk banks and found that there's no evidence for any sort of milk donation deferral. And at Hearts, very early, we adopted that if you'd had a vaccine, it didn't matter about donating, you could still donate straight after, as we do for every other vaccine other than the live ones. So I just want to end on positivity, because a miracle has indeed happened during the pandemic, and that's this collaboration and greater communication between individual milk banks. Before the pandemic started, we weren't even sure how many milk banks there were in the world, how many countries, how many babies have access to donor milk, and in what settings, and what challenges we're facing. So we put together a number of research projects to answer some of those, and found that there's a lot of milk banks, although perhaps fewer than you might expect, in about 66 countries. And that an estimated number is that they're feeding around 800,000 low birth weight or very low birth weight babies. But that's in the context of about 1.3 million low birth weight babies being born each year. So there's a gap. And what challenges? Well, we're all having the same issues, but in unique ways. And we managed to put together a paper highlighting what they were and how future investment in research could safeguard those. The Global Alliance Group is now formalising, initially under the Human Milk Foundation, but it will become its own discrete entity over time and represents over 40 countries now, and is working with a number of levels at the WHO to try and raise the profile, come up with minimum standards, and start on research. Within a week, we put together a campaign for the World Day of Human Milk Donation in 2020. That was quite a remarkable effort, but we had lots of enthusiasm and came up with these remarkable photos from around the world, showing what milk banks felt should be highlighted, honouring donors, but also emphasising that these voices, these experiences need to be heard. And to finish, I just wonder if we could play the 3-year video from the Human Milk Foundation. I'm not sure I'm going to be able to do it from my PowerPoint, but if the organisers could flip that on. And I'll just finish by saying thank you, and I hope that came across okay.
That was amazing, Natalie, and I'm not surprised that you have no memory of periods of last year. The just sheer volume of work and change and advocacy that you have managed to achieve in this period, it's truly incredible. And I think that what you've shared really highlights the damage done when policies don't recognise the importance of human milk and treating mothers or lactating parents and their babies as a unit that should not be separated and certainly should not be underestimated. And Catherine, you have the video set up.
I might be able to get it through my...
I have shared the link to the video, sorry, just in the chat. I'm just aware that it is now 11:03.
Yeah.
To make sure that we get to hear everybody for the rest of the session.
Sure.
Thank you so much.
Great.
Natalie.
Thank you. Yes, and Catherine, as you said, we are over time, but I hope that we really want to hear from Clare Patton. So obviously, if anyone has any other commitments, they need to nip off. But thank you so much. It's absolutely fascinating to hear from you both. And I want to hand over to Clare Patton.
Thank you. Catherine, are you putting my slides up? Or, oh, brilliant. Thank you. Okay, so I had been told already that I was just kind of coming on at the end to say something very, very quickly about this, and the floor really belonged to Janet and Natalie quite rightly because of everything that they were talking about. But I also am very conscious of time, and I'm also speaking at another panel later, and so I'll have the opportunity to kind of talk about the things broadly speaking that I'm talking about here. So I'm really going to fly through this very, very quickly so that hopefully there'll be time for everybody to ask ask Natalie and Janet questions about their amazing presentations. Catherine, can you put that onto the next slide? Is that how we're working this? Okay, so we can move to the next slide again. And yes, we'll just pause there for a second. This is just to give a very quick example of the type of advertising and marketing that was happening throughout COVID. So the one there to your left, I think would be your left as well, the lady with the stethoscope. So there was lots of this kind of co-opting and using COVID to legitimize marketing practices by putting health workers, healthcare professionals out to give advice that was actually rooted in truth. It was rooted in the truth of what was being told by WHO and by public health agencies, but then it was extended to make sure that it fits with the business model. And so you can see in the middle of this one, it says mothers should stay 6 feet away from the baby. That was never given as advice. And as you can hear from listening, or as you heard rather from listening, both Natalie and Janet, you know, this goes against the advice that was given by healthcare professionals. So of course, following that type of advice is going to make breastfeeding extremely difficult. And then the focus again on immunity. This has been something that's always been spoken about with the marketing and advertising of breast milk substitutes, but came to the fore and was much more common during COVID. So there was much more of a focus on how feeding breast milk substitutes and you know different additives and things that they were adding to it was going to give the child a much stronger immunity. Next slide, please, Catherine. So there's some research that has been done. This research has got out a lot quicker than my own research. And so there's 2 papers that I have put on here. I think the slides are going to be publicly available and there are links to those papers. So we can just slide on from there. It's just really talking about the research that has been done. And in that particular paper here, this is an example of an advertisement that was shown in Vietnam, and we can see the WHO Director General's photo has been used, and he obviously didn't give authorization for that. And then you can kind of see in that box the type of thing that they're talking about, you know, fear tactics, scare tactics about COVID spreading rapidly, etc. So next slide, please, Catherine. And then this is something that I could talk all day about. This is cause-related marketing, and this is whenever a corporation will attach itself to some sort of philanthropy or charity to sort of whitewash or greenwash its actions. So they're over here doing something that's really unethical, but they're kind of going, but everybody look over here because this is what we're doing that's really, really great. And they did a lot of that. The BMS industry did a lot of that throughout COVID. So attached their name to lots of charity type initiatives. And of course, whenever they're supplying formula to parents and to mothers, this is really just a free sample because they're not making any commitment to follow right the way through for the entirety of the needs of that child. Next slide, please, Catherine. Next slide, please, Catherine. Again, that's just some more research that was going on. So just to finish up, really, and as I say, my apologies, I knew that this was going to be a quick one, but I'm rushing through it even faster. So what does general BMS marketing look like? Well, the BMS industry want to persuade you, the potential consumer, not to breastfeed. That's the nuts and bolts of it. That's what the industry want you to do. And that's what their job is, to try to dissuade you from that. And in normal times, they have a proven strategy of how they will go about that. And so they will cause doubt. And the doubt is in your ability to breastfeed. And they do that by using language that will infer difficulty with breastfeeding and ease with their product. Or that it's, you know, it's maybe not sustainable. Not all mothers can breastfeed, but they don't mean not all mothers can biologically breastfeed. They mean it's a lifestyle choice. And they're there to support the mothers who feel that they can't breastfeed. Cause confusion. So there's a lot of this that goes on. It's very insidious, it's very subtle. So in one way, the industry supports breastfeeding because you'll see that they will so often say, you know, Nestle supports breastfeeding, Danone supports breastfeeding, Orbe supports breastfeeding up to the age of 2 and beyond. But that's really just their caveat before they then go on to promote their own products. And so to a consumer, it looks like, well, they really do have the best interests of the mother and child at heart because they are saying that they support breastfeeding, and really all they're doing is giving another option. They're just providing another option. And then other types of confusion is to cite lots and lots of science. It doesn't really mean an awful lot. And they do that both in Q&As on social media or in their advertisements. right across all different forms and platforms. And then just offering absolutely bombarding the shelves and the consumer with different options, good night formula, hungry baby formula, premium formula. So all of these different formulas that can then undermine, again, a mother or a parent's ability to feed, because they're thinking, well, surely my milk can't do all of this vast array of different things. And then cross promotion is usually used to implicitly advertise. So that is where a company will use the exact same branding from birth right the way through to 36 months. And it means that they can then advertise their newborn formula, their infant formula, whenever it's usually banned, or it's often banned. It was prohibited through the WHO code, and then usually domestically there will often be some sort of ban on that. So what it does is it allows them to insidiously market newborn formula as well, because unless you look very, very closely at the packaging, you won't be able to tell the difference between the formula that is for newborn or the formula that is for the follow-on milk. And then lastly, the vulnerabilities. So it's preying on the really common and very normal vulnerabilities that we all feel whenever we have had a baby. We're really, really sleepy. We're sleepy because the baby's not sleeping and the baby's getting up. And so this formula is, this sleepy formula, this hungry formula. And as part of this vulnerabilities, preying on vulnerabilities, it also encourages really kind of on the slide, this division between mothers, this competition, this motherhood competition that goes on, breastfeeding mothers against bottle feeding mothers, parents who co-sleep against babies who are put into cots and things like that. And one of the really good, and so they then come in and step in as an ally. So they're seen as the good guy, if you like. And so one of the best examples of this is the Sisterhood of Motherhood ad, and the link is there, and I would suggest that you watch that whenever you have a few minutes. So in sum, it's doubt, confusion, cross promotion, vulnerabilities. This all feeds into the decision as whether or not to breastfeed, and what that results in is lots and lots and lots of big profits for the BMS industry and their shareholders. Next and final slide, please, Catherine. So is there any big surprise at the tactics used by the industry during COVID? Absolutely not, none whatsoever. It's the exact same strategies and tactics that they have been using for over 40 years. They just molded it and shaped it and made it into bespoke marketing to suit COVID and to play on all of the different fears that we see, the doubt, confusion, cross-promotion, vulnerabilities. So doubt, that's there in normal times, but then this is exaggerated in COVID. Confusion. There was lots and lots of confusion from the WHO, from domestic public health authorities. We've listened to both Janet and Natalie talk about where are we supposed to get the vaccine? Are we supposed to breastfeed? And so because of that inaction and confusion that was acceptable in the beginning, but then got drawn out for way too long, that left this gap that then allowed the industry to come in and fill and offer, a safe hand and advice through their own professionals. Cross promotion here, it was really where it kind of sat outside the usual definition of cross promotion, but it was really where they were bringing they were marketing infant formula in ways that they wouldn't normally do it, because they were showing their older formulas and really pushing it as boosting immunization and providing immunization, which of course fed into fears then of parents at that time. And then the vulnerabilities, they really played on the fear of women, can we breastfeed? Can we get vaccinated? They're putting their product in and go, you don't need to worry anymore. Use this, and then you cut that fear out of your life. That's my final slide, Catherine. If you just want to go to the very last one, it's just to say thank you very much for inviting me. As ever, this is my third year. Love it. Even more every year. So thank you for inviting me. Loved being on this panel in particular, and I look forward to seeing any of you who can make the panel at 1 o'clock. Thank you. That's me.
Well done, Claire. Thank you so much for that absolute whistle-stop tour. Every time I hear you speak about these insidious and nefarious tactics, I know about it, but every time I hear it laid out so plainly, it is still shocking every time. The way that companies exploit women and profit off of families thank you so much for sharing that work, and I really encourage anyone who is interested in hearing more about that to join our celebration of the code at 1 p.m. this afternoon. We obviously have run over and I'm happy about that, because it's been an absolutely fascinating tour of all of your work. So I'm not going to open the floor to questions. I think we should wrap up, but I'm just going to invite each of our panel members to make one final comment about what you see as the opportunities as we emerge from COVID, and based on what we have learned, what do you think are the key opportunities moving forward for the world of breastfeeding and supporting breastfeeding? Janet, can I turn to you first? You're muted still.
Thank you, Jennifer, and thank you so much for allowing me to be part of this session. Claire, I think you're amazing. I think Natalie's amazing too, but Claire, I just love your talks. I just love how clear you are and the fact of your background. But my thing I need to say is that I think COVID has provided an opportunity for us to learn about how to be supporters online and how to do that well. And so I think we must hold on to that. But please, please, please don't let us replace face-to-face with online, because nothing beats being there in the room and really, really understanding how somebody's feeling and making them feel like you get it. It's not the same online. So let's make sure we protect and grow our breastfeeding support groups in Northern Ireland, that they're good and they're accessible.
Thank you, Janet. Natalie, same question to you.
Yeah, I mean, I think everybody who's supported women throughout this whole pandemic deserves a medal of some sort. But from the point of view of human milk banking, I think it's almost like the opposite bookend to the 1980s, that it's the potential to revitalize. I think people are seeing breastfeeding in a different way now. I think the last 2 or 3 years has been a shift in certainly policy-making consciousness at some level, but also national public consciousness as well. And it's about being able to lay the foundations to make a really sustainable infrastructure that can embed with hospital and community services. So if you get a chance to watch the video, you'll see some of the plans that we've got there.
Excellent. Thank you, Natalie. And Claire.
Thank you. I would just take the opportunity that has arisen, if you like, from COVID, probably framing that in a bad way, but you kind of know what I mean, that if we were going to take something from it, what I would say from the point of view of my work would be that there is a lot more focus now on misinformation and disinformation online than there ever has been in the past. And so maybe in terms of breastfeeding, we should be using that to our advantage and getting everybody to make sure that they are questioning everything that they are reading, and where the sources, who's paying for this, this study, who paid for that study, to think like that, to be more critical in their thinking about the information that they're receiving. Question everything.
Excellent. Thank you so much, Claire. But yeah, it just remains to say thank you again to Janet, Natalie, Claire, and to our Lord Mayor of Belfast, Kate Nicholl, for joining us earlier. We will be sharing on Twitter and through Instagram and Facebook any of the links that are here in the chat. But thank you all for joining us, and I hope to see you again at some of the rest of the events today. We have to go now, so we can start singing science session next for a bit of fun with the babies.